Hi, this is Ron Kinscherf with Muddy River News. This is the Business Spotlight brought to you by Mercantile Bank and Robert Phillips, attorneys at law. We are joined by a doctor from Blessing Hospital, Arshad Muzaffar, a plastic surgeon by trade, correct?
Yes.
Specializing, though, in cleft palate type situations.
Yep. Craniofacial surgery.
Correct.
Yeah.
So how did you, I'm assuming you picked plastic surgery first and
Yes.
then went into that part
Yes.
of the industry? So what drew you to dealing with microfacial injuries?
Actually, the thing that got me interested in plastic surgery was as a medical student seeing pictures in medical textbooks of patients with cleft lip and palate and their outcomes after surgery. And that captured my interest and imagination, and so that led me down that path.
There aren't a lot of you in the country, are there?
No, there are not. It's a small group of craniofacial surgeons who are fellowship trained.
And it requires an entire team of people to join you for these type of procedures, correct?
Ideally, so the care of patients with cleft lip and palate is ideally done in a team setting,
Okay.
which is multidisciplinary.
So why is that required for this type of situation?
Because these patients have a lot of different needs, not just a surgical component or even just a plastic surgery component. They may need ENT surgeries, for example, for their ears, if they have hearing problems. They need speech and language pathology. They need orthodontics and dental care. They need psychosocial care. And so there are multiple different disciplines involved in taking care of a patient with cleft lip and palate.
I was going to ask you about the psychological aspect of this because is it classified as a deformity?
It's a birth anomaly.
A birth anomaly, so there
Yeah.
has to be, and you start with the individual at a very young age and then work, we talked about this earlier, and then you work throughout their teen years, correct? And
Correct, yeah.
So that's got to be tough on a kid to grow up looking different than the rest of their friends and classmates.
It can be. The psychosocial burden
Right.
is significant. And so, we do as much as we can, both in terms of surgically trying to help them present as normal an appearance as possible. And ideally, if we do our job properly, people often have a very difficult time even detecting that they were born with this problem.
And the reason we're talking about this, as July is National Cleft and Craniofacial Awareness Month, and why do we need a month like this?
I think cleft lip and palate is one of the most common birth defects, similar in incidence to something like Down syndrome.
It is?
Yeah,
Okay.
which is something that most people are very aware of. And cleft lip and palate has a similar incidence, 1 in 600 to 1 in 700 live births in the United States. So that's quite common.
That's quite common. And do the parents know prior to the child being born that this condition is there?
So that's a great question.
Well, thank you.
Sometimes
I got one right, Steve.
with prenatal diagnosis, it's oftentimes, at least if there's a cleft lip and not just a cleft palate involved, that can be seen on prenatal ultrasound. And so we like to see the parents prenatally so that we can teach them about cleft lip and palate, especially how to feed the baby when the baby is born. And so we can really prepare the parents, because you can imagine if they don't know about it ahead of time or they don't have much education, it can be quite a shock when they're told your baby has cleft lip and palate.
So why don't we just, a real quick definition of what a cleft situation is.
Sure. So when we talk about cleft lip and palate, we're talking about a disruption or interruption in the lip, and then sometimes the underlying gum line where the teeth come out, and also the palate, which is the roof of the mouth. So the clefting, or the separation or interruption of structures, can involve all of those, as well as the nose, because the nose is affected as well, being attached to all of those structures.
So what type of effects would this have? Like you mentioned feeding. I hadn't thought about that, but what type of effects as the child grows into young adulthood would they have?
So obviously the appearance is the most obvious to a casual observer, but then speech, hearing, facial growth, and feeding are all affected. Feeding is usually something that can be easily managed once we teach the parents early on, so that's usually dealt with. But speech, hearing, facial growth, and dental issues, dentoskeletal issues, we call them, the way the teeth and the jaws grow and develop and fit together. Those are long-term issues that most of these kids are in treatment for several years.
Requires multiple surgeries generally, correct?
Typically, yeah.
And why? Why are there multiple surgeries?
Because certain surgeries should be done at a particular time in growth and development. So, and that's one of the challenging things about taking care of issues like this because there's the factor of growth and development that needs to be taken into consideration. So we don't want to do the wrong operation at the wrong stage of development. We can cause problems. And so, for example, we would repair the lip and the nose and maybe part of the palate early on in the first few months of life. And then sometimes they would have another operation before kindergarten to do a minor revision of the lip or the tip of the nose. That we try to get those things done before they start school so they can present their best appearance. Similarly, we try to have speech and communication issues optimized before they start school. That's really a key landmark in terms of growth is starting school.
So from a financial perspective, and this might not be something you can answer, how difficult is it for a family or a parent to deal with multiple surgeries for, that's like over 15 years.
Good question. So insurance legally must cover treatment for cleft lip and palate. Where we've encountered challenges sometimes is dental and orthodontic components of care, which again, they really are mandated to take care of, but it can be much more challenging to get third-party payers to cover that.
Is the dental, that aspect of it, done by a dentist, or is this done by folks on your team?
Well, both dentists and pediatric dentists and orthodontists. So on the team, we have an orthodontist.
You do, okay.
Yep, and but ideally, if you definitely want to partner with dentists and pediatric dentists because routine dental care is very important for them, aside from the more specialized orthodontic care.
How often do you see this? And again, you're based in Quincy.
Yeah.
There's not many of you, 200 teams that do this
in
type
the
of
country,
stuff?
yeah, approximately.
So how often do you see, I'm assuming you got people travel from around the area.
We do. So I have many patients that come from outside the region, from Missouri, the Columbia area, and other parts of Missouri, from other parts of Illinois. I have patients who come to me from Seattle. I used to work at the University of Washington, Seattle Children's Hospital. I still have patients come here from there. So really a broad catchment area.
Yeah. It's got to be, you do other types of surgeries too.
Yes.
This is not your only thing, but since it's the awareness, Cleft Palate Awareness Month, dealing with a patient for that long, that relationship has to be so much different than a lot of doctors have.
Yeah, it is, and it's one of the most rewarding parts of doing this kind of care. I mean, I've had many patients now that I've taken care of from their birth through graduation of, from high school, and I routinely will get graduation invitations and updates on how kids are doing in college or, in their adult life. So that's very gratifying.
I bet it is. And do you, does the process ever end for those patients?
Sure.
So there is a final procedure and you're like, I'm all done with
Most of the time that is true, and that's usually by the time they're graduating high school for most kids. Now, there are adults with cleft lip and palate who might need, for example, more nasal surgery at some point if they're having nasal breathing problems, or might need some further minor revisions if they have some cosmetic issues that they'd like to address. But most of the time, by the time they're graduating from high school, we're pretty much finished.
So is this a roll of the dice type birth anomaly, or are there things that occurred during the pregnancy or prior to the pregnancy that can cause this?
It's something that's called multifactorial. In other words, there are many different components that can contribute to it. There's a genetic component, but there are also nutritional, environmental components, exposure components during pregnancy. So there are a lot of different factors that can contribute to this.
So basically, it's like anything else. If you are pregnant or any aspect of your life, leading a healthy lifestyle will help.
Yeah, for example, smoking during pregnancy is associated with clefting.
Is there continued research in terms of, prior to becoming a patient of yours, is there continued research there? And is there continued research in terms of equipment or processes you can use as the surgeon?
So there's definitely ongoing research in terms of the genetics of clefting and the etiology. And there's continuous evolution really in terms of surgical techniques. And the main areas of research now in terms of surgical treatment are how to standardize and optimize the treatment protocols to get the best speech and facial growth results. If you go to 10 different cleft lip and palate treatment centers, you will probably encounter 10 somewhat different treatment protocols. And ultimately we would hope to identify something that is the best or close to the best way to do this. And that's really the main focus of long-term research. And you can imagine if you're treating them from birth through completion of growth, growth is the X factor, and sometimes we don't know how well something that we do is going to turn out until they're grown. So these studies need to be done long-term over many years.
Is this an underfunded type situation when it comes to research? Because we hear about all these other type of, and I've never heard of anybody that's for,
Compared to some other conditions, yes,
okay.
it is, yeah.
Okay, one last question. What do you want folks to know in this area that may be watching this, other than we do it here in town?
Yep.
What else do people know?
So we have a nationally accredited multidisciplinary cleft lip and palate treatment team here. We're accredited by the American Cleft Palate Craniofacial Association, which is the primary national organization, professional organization that deals with this. We can take care of children with the cleft lip and palate and many other craniofacial anomalies here in Quincy, and can spare families the expense and time of traveling far away for treatment.
You love what you do, don't you?
Yeah.
It just comes across like that you have a passion for helping these kids get, I don't want to say get their lives back, but
it's very rewarding.
I can imagine.
And we, as you pointed out, we have a chance to develop long-term relationships with all these families and kids, and that's, that I can't overstate how rewarding that is.
I can imagine.
So.
Thanks for coming in.
Thank you. I appreciate it.
Again, July is National Cleft Palate Microfacial
Cleft and Craniofacial Awareness
That's
Month.
what I meant to say. Dr. Arshad Muzaffar, thanks for coming in.
Thank you.
This has been the Business Spotlight. I'm Ron Kinscherf for Muddy River News. This is brought to you by Mercantile Bank and Phillips, attorneys at law.